Hi, I'm Grace, and I am going to be explaining the impact of maternal nutrition and overcoming structural obstacles to ensure health during pregnancy. So, maternal nutrition plays a crucial role in maternal health. This video essay is going to highlight the role of maternal nutrition for overall health while also addressing structural barriers that make it challenging for women to access proper nutrition and food. This video will highlight the different structural barriers that women face to access proper nutrition during pregnancy, while also explaining the importance of nutrition during pregnancy for the mother and child. So, maternal nutrition during pregnancy is very important for health of not only the fetus but also the mother as well. Low income or marginalized women are seen to face structural barriers to proper nutrition during pregnancy, and this impacts their overall health during and after pregnancy. Pregnancy increases the need for nutrients such as iron, protein, and vitamins. For example, during pregnancy, the placenta will take most of the mother's iron to support the fetus's growth and development for red blood cells. This can leave the mother iron deficient if her diet does not supply her with iron-rich foods. This quote by the WHO explains that menstruation, pregnancy, and lactation all increase a woman's need for protein, vitamins, and minerals. Worldwide, 450 million women are undernourished compared to 400 million men. Women with anemia is a total of 458 million women compared to men, which is 238 million. This quote by a health article explains some tips for pregnant women to ensure health. And they say that pregnancy can deplete the body's nutritional stores while also increasing nutritional demands. You need a natural source of vitamins, minerals, and other nutrients to create the healthiest environment for your baby. A WHO statistic shows that 450 million women worldwide are undernourished. And they also explain that menstruation, pregnancy, and lactation all increases a woman's needs of certain vitamins. A case study from India highlights how cultural food beliefs influences restrictions in diets. For example, the women in this area of India avoid hot foods because they believe that it will cause a fever during pregnancy. Although it's important not to criticize beliefs and cultural practices, it's important to highlight how misinformation and misunderstanding of nutrients can impact the health of pregnant women. This case study also highlights how limited income causes poor diet quality and how women are restricted to certain meals that they can afford, such as rice, which is sometimes mixed in with vegetables, if possible. More nutrient-rich foods like eggs and milk, meat are more expensive, which can limit the intake of essential proteins, iron, and vitamins, which are needed for a healthy pregnancy. Women with lower incomes suffer from infrequent healthcare visits due to costs, transportation, education, geography, especially in rural settings, and other factors. Infrequent visits can limit the access of what to eat and what to do during pregnancy and how to take care of their bodies to ensure good health. These barriers create health disparities and violence upon women with low income. Poor healthcare access and high cost will worsen nutritional habits. So, affordable foods for women who have limited income are more likely to be high quantity and low quality foods. So, less affordable foods are usually nutrient dense. A study in Guatemala showed that a control group of pregnant women without a protein supplement had a negative effect on the woman's overall health and fetus growth, compared to the experimental group who were given a protein supplement throughout their pregnancy who showed better overall health. The study proved it's important for certain vitamins like protein for pregnant women because protein is essential for the immune system because it helps build antibodies and immune cells. A study conducted titled The Influence of Maternal Factors on Mode of Delivery and Birth Weight in Urban Pregnant Women collected data through interviews and hospital records. The data focused on diet and delivery outcomes of different women. The results highlighted the importance of basic nutrition education to help women maintain a healthy BMI during the childbearing years. Certain seasons also impact food access, especially for women who live in rural settings who rely on farming for food access. Studies have shown that early enrollment of programs like WIC is very helpful for providing nutritional foods in order to stay healthy for women. WIC is a federal funded program that provides nutritional supplementation, nutrition education, health, and other services for low income pregnant women and children up to 5 years old. Some challenges are that not everyone knows about WIC or signs up early enough. This can be solved with things like public outreach programs. This can look like programs that give food through stores to help spread awareness about the available programs in public settings, using ads on the radio or television, or just local healthcare providers and clinics spreading more information. Finally, women need support with food access before they become malnourished. In order for this to happen, structural issues such as poverty, education, and healthcare access must be addressed. Overall, preventative support is more effective than trying to treat malnourishment. Overall, maternal nutrition is a public health issue that must be addressed through structural issues and federal support programs and education. Thank you for listening.